Knock, knock.
Come in.
Hello, Mr. Salem. My name is Tariq Salem. I'm a second-year medical student here at UAMS. I'm going to be performing a GI, gastrointestinal physical exam on you today. Is that okay?
Yes.
Okay, thank you. So I'm going to go ahead and wash my hands before moving forward. Okay. Mr. Salem, is it okay if I drape you?
Fine.
Okay, thank you. So I'm going to go ahead and just place this drape over your legs, and if you can, just place your feet over at the end of this bed right here.
Okay. All right.
Thank you, sir. And if you can, just please flex your knees just a little bit. Just raise them up slightly like that.
Okay.
That's perfect. Thank you.
All right.
Now, would you mind if I raised your shirt up a little bit?
Sure.
Thank you. Yeah, so normally in these exams, we will have to expose the skin of the abdomen. So, okay. Perfect. Thank you. So now what I'm going to do is just a general observation. I'm just looking to see the general wellness of the abdomen, and everything appears to be normal. And now I'm going to go into a more specific observation where I go ahead and I look to see if there is any fullness or distension of the abdomen. I'm going to go ahead and check and see if there are any evident masses or hernias, if there's any evidence of scarring, or I'm going to go ahead and also check and see if you have any skin changes such as erythema, jaundice, ascites, anything that seems out of the ordinary. Okay, so Mr. Salem, I'm going to go ahead and I'm going to auscultate your abdomen if that's okay. Okay. Thank you. So what I'm going to do is I'm going to listen to the four quadrants of your abdomen. And so before we move forward, do you have any pain anywhere in your abdomen?
No.
Okay, thank you. So now we're just going to begin in the right upper quadrant of your abdomen. I'm going to go ahead and I'm going to use the diaphragm, and we're just going to listen right here to see if we notice any abnormal bowel sounds. That sounds normal, and then we're going to move to the left upper quadrant. And now we're going to go ahead and move down to the left lower quadrant. And then we're going to go to the right lower quadrant. Okay, that sounds normal. And now we're going to go ahead and we're going to use the bell of the stethoscope. And I'm going to go ahead and I'm going to listen at your midline for any aortic bruise. And this is just to see if you have any irregularities in your arterial flow of the aorta. Okay, sounds normal. And now we're just going to move over a little bit and we're going to check the left renal artery for any renal bruise. And I'm going to go ahead and also check the right renal artery as well, just to be safe. Okay, sounds great. So now we're going to go ahead and we're going to move on to the percussion portion of the exam. I'm going to take my left hand and I'm just going to place it on your stomach, and I'm going to lightly tap my middle finger, and I'm just going to listen to see for any dullness or any irregularities. So we're going to begin in the right upper quadrant, the left upper quadrant, the left lower quadrant, and the right lower quadrant. Okay, that sounds normal. And now I'm going to go ahead and I'm going to check your liver span. I'm just going to begin at your mid-chest around the midclavicular line, and I'm just going to move down and just check for the size of your liver using the same technique we just talked about. Okay, sounds normal. Okay, so now we're going to go ahead, and now that we've done the inspection and observation, the auscultation and percussion, I'm going to begin the palpation portion of the exam. I'm going to begin by doing a light palpation, and to do this, I'm going to take my right hand and I'm going to form a pad with my fingers, and I'm just going to lightly move around your right upper quadrant of your abdomen, and I'm just going to do this to check for any muscle tenderness or rigidity. In the right upper quadrant, the left upper, the left lower, and the right lower. Okay, great. So I'm gonna go ahead and I'm gonna do a deep palpation, and for this, I'm gonna go ahead and I'm gonna take my left hand and I'm just gonna place it over your right upper quadrant and place that same padding from my right hand over the left hand and just do the same kind of motion. Here I'm just checking to see if there are any masses or any abnormalities with any of your internal organs. And that feels normal. And we're just gonna go through the same process through the quadrants, beginning with the right upper, left lower, and then right lower. Okay, and that seems all normal. And so now I'm gonna go ahead and I'm gonna check for your liver. I'm gonna palpate that. And so to do this, there are a few steps. I'm gonna go ahead and I'm gonna take my left hand and I'm just gonna place it under the right side of your body, below, or excuse me, in between the right 12th rib and your iliac crest. And I'm gonna take my right hand and I'm just gonna place it under the costal margin in the right upper quadrant, lateral to the lateral rectus muscles. And Mr. Salem, if you could, just please take a deep breath in and then a deep breath out. Okay, thank you. And so now we're gonna go ahead and we will palpate for the spleen. And so to do this, I'm gonna take my left hand and I'm gonna take your left rib cage and I'm just gonna support it with that hand. And I'm gonna take my right hand and I'm just gonna place it right under the costal margin on your left side. And if you could do the same thing for me, just take a deep breath in and a deep breath out. Okay, thank you so much. Okay, and so now I'm gonna go ahead and I'm gonna assess for any rebound tenderness. We can do this to check for appendicitis or peritonitis. And so Mr. Salem, what I'm gonna do is I'm gonna take my hand and I'm just gonna apply a deep pressure to your abdomen and just let me know if you feel any pain whenever I release it, okay? No pain?
No pain.
Okay, great. And so now we're just gonna do a manual palpation of the kidneys. I'm gonna take my left hand and I'm gonna do something similar to earlier. I'm just gonna place it under the flank and I'm gonna take my right hand and I'm gonna point my fingers towards the left side of the abdomen and I'm just gonna feel under that rib cage for the inferior pole of the right kidney. And the right kidney sits a little lower, so it is easier to palpate compared to the left kidney. Okay, now I'm gonna go ahead and do the same thing here. I'm just gonna take my left hand, just place it under, and then just see if I can feel for that left kidney, but it's a little harder to feel. So. Okay, thank you. So now we've palpated for the liver, palpated for the spleen, the kidneys. We've tested for your rebound tenderness. And now the last part of the exam is I'm gonna go ahead and I'm gonna check for costovertebral angle tenderness. And if you could, I'm just gonna leave this drape on you. And if you could just drop your knees and your feet over to this side for just a moment and sit up for me. Thank you.
All right.
So now I'm just gonna go to the back, and the costovertebral angle is it is right below the 12th rib, and it is the angle. It almost forms a triangle, and it is the point where your spine meets your rib cage right here. And so what I'm gonna do is I'm gonna take my left hand and I'm gonna make a fist with my right hand. And Mr. Salem, I'm just gonna lightly tap your back at this angle and just let me know if you feel any pain, okay?
Okay.
Any pain?
No pain.
And I'm gonna go ahead and I'm gonna do the same thing for the right side, just placing my left hand over it and just light taps over. Any pain?
No pain.
Okay, thank you. Okay, Mr. Salem, I think that concludes your encounter. I can go ahead and remove this drape from you if that's okay.
All right. Thank you.
Thank you. And so before we finish up here, do you have any extra questions that you'd like to ask me or anything?
No, that's fine. Thank you.
Okay, Thank you. I think that'll be all then.
Appreciate it.
Absolutely.